Fractures of the extremities, as in the hands and feet, are the most common types of fractures, and the normal way of trying to diagnose them is with a two-dimensional X-ray. But this is difficult because you have lots of little bones in these areas and they all overlap when superimposed in 2D. You can have 3D imaging in the form of CT or MRI, but this is much more expensive, takes a long time to organise, and in the case of CT gives a considerably higher radiation dose. What we have here is a low dose, low cost 3D imaging system that can go on the desktop. On the base we have an X-ray detector, so the hand would be placed here, and on the top we have a special X-ray source that instead of just being a single X-ray source that would give you a two-dimensional image, there's a whole array of emitters that can be fired in a sequence from different positions in order to give you 3D information. So let's have a look at some of the images here. So on the left we have a two-dimensional X-ray of someone's wrist, and you can see that there are some overlapping bones here making it difficult to see what's happening. Whereas with our tomosynthesis images you get a stack of images through the volume in 3D, and then using a mouse wheel you can scroll up and down and see the individual layers of bones, giving you much more detail about the joint spaces, much more detail about the spongy trabecular structure of the bone, which would make it much easier to spot fractures. Another key area is fractures of the feet, and with this device it's possible to do weight-bearing imaging by turning the device on the side and having the patient standing on the floor on a little step. The images can be taken when the patient is in the position that causes them pain. With a CT scanner, you'd be lying down nice and comfortable and you might not see the position that causes pain to the patient. Whereas with a device like this, weight-bearing imaging of the foot can be done. I'll take the cover off and you can see this is our flat panel source. So this has 45 individually controllable X-ray emitters in a flat panel that can be fired in a rapid sequence in order to give us enough data to derive 3D images. Here's an example of some of our foot imaging. So you can see the different bones, and as we scroll through you're getting nice detail of the structure of the bone. You can see the individual joint spaces, and you're even getting a little bit more soft tissue detail there. So this is really a transformational change where instead of having this old-fashioned two-dimensional X-ray technology as the first line of imaging when a patient first arrives or when you want to give them a checkup a few weeks later, you're giving them much more informative 3D imaging when they first arrive and avoiding the cost and expense of CT scanning and MRI scanning for those initial cases.